Welcome to the Joy of the Hang. I'm your host, Sharon Stevenson, and today's conversation is one that every woman deserves to hear. We're talking hormones, vitality, and what it really means to feel good in your body again. My guest, Dr. Victoria Andarcia, is a board-certified internal medicine physician with advanced training in integrative and functional medicine. She practices at Reveal Vitality in downtown Sarasota, where she helps women rebalance their hormones, reclaim their energy, and rediscover their joy, especially through pivotal life stages like fertility, perimenopause, and menopause. Dr. Andarcia believes that true healing comes from understanding the root cause, not just treating the symptoms, and her passion lies in helping women take back control of their health through education, lifestyle, and empowerment. So if you've ever wondered why your body feels different lately, or how to navigate hormonal changes with grace, confidence, and even humor, this is your episode. Welcome.
Thank you for having me. I'm excited to be here.
I am so looking forward to this conversation. So we talked a little bit before we started the podcast about some of the issues I had in just trying to find information about what hormones to take. So I am 59 years old, postmenopausal by almost 10 years, probably at least 10, and have talked to several doctors in town. And recently somebody told me that because I'm 10 years post, that I wasn't even eligible for hormone replacement therapy. So tell me let's dispel some myths right off the bat.
Okay, dispelling myths is my favorite because I've heard this all before and it's really unfortunate. So what happened is we're having a hormone renaissance is what I call it, because women were on hormones, then the WHO came out and said hormones cause cancer, and then we scared a bunch of women into stopping their hormones entirely, and now we're revisiting that data, having more information, and we're seeing that what we actually thought was harmful or detrimental about hormones is not actually true, and there's a lot of benefit. So this, if you're 10 years post-menopause, there's no benefit or it's harmful.
Right.
That was part of the old data. So there's a lot of advantages to being on hormone, and I think the other thing that doctors don't realize is that it depends on the individual. If I have someone who has 20 medical problems, is taking 15 medications, maybe you want to be a little bit careful starting that person on hormones, but if you're generally healthy, hormones can be beneficial and can help improve your quality of life, can give you more energy, can increase libido, can help maintaining muscle and bone mass, which is really important as we get older. So it really needs to be looked at like on a case-by-case basis, and I think that's where doctors get confused.
Yeah, it's confusing for patients too. Trust me, I was so confused because, I was looking at all the different, I guess you'd call it modalities, mm-hmm. and one being, a lot of my girlfriends had the pellet, had a pellet inserted. A lot of them also had problems with the pellet. Others were taking a testosterone a shot a couple of times a week, right? Now, I don't love needles, so for me, that was out right from the beginning. So then someone said, well, you can just take pills. So then I was put on a course of testosterone, estrogen, and progesterone. So anyway, now I'm not doing any of it because I'm so damn confused, because then I was told by someone else, well, it's not getting into your bloodstream properly through orally, right? So yeah, it's all over the place. So tell me about that. Like, what's the difference between a pellet versus having a shot a couple of times a week, and that is that on a case-by-case basis?
It is, and one of the things I tell people is that when you're doing hormones, it's like shoe shopping, right? You have flats, you have heels, you have boots, like there's so many different options, and it really depends on the person. Now, I'll start with the pellets because the pellets are controversial, and the reason they're controversial is because they're expensive, they're not covered by insurance, but you can have more side effects because, the pellets are the size of, a grain of rice, and you're putting it in the glute, in the fat in the glute, and that will last 3 to 4 months generally. And what can happen with that is that sometimes it's not, it's dosed too aggressively, but regardless of the dose, if you have no hormones, you're postmenopausal, and you insert a pellet, your hormones are going to go up quickly, right? And people can have side effects from that quick rise in hormones. And I think that's where the bad rap comes from. I tend to be a little bit more conservative when I'm doing pellet dosing. Like, we have a dosing calculator. I go under because I'd rather put more later than start someone aggressively and then have them have all the side effects and they hate pellets. I think pellets are great because it's a set it and forget it. You just put it in and you don't have to worry about using a cream, injectable, or anything else for 3 to 4 months. So I find that for convenience, they're great.
So what's in the pellet?
So in the pellet that we use in the office, so we have estrogen and testosterone. You don't do progesterone pellets, so it's just those two. And it's the hormone, which is bioidentical. They get the hormone from yams, and then ethyl cellulose. And we also have triamcinolone, which is a steroid. It coats the pellet because one of the side effects from having pellets is that it can extrude, like come out, and you can get some scar tissue. So with that steroid coating, it helps with the healing so that you don't have the extrusion, and it can minimize the formation of scar tissue. But it's just those ingredients.
And is it so it's a slow release formula?
Yeah.
So some women have complained of having spikes though. Is that normal, or what would cause a spike?
Okay, so some of the ethyl cellulose in the pellet makes it slow release, but there are some, depending on what's on them, that you do have like a higher spike. So for people who are switching, we use Avexipel is the name of our pellets. If we're using Avexipel and someone comes in on a different hormone pellet, we have to use the ones that are faster release so that people can get that high from the initial dosing of the hormones, which you're not going to get with Avexipel because it is slow release.
Okay.
But some people like that when you're injecting testosterone, or if you're using a different pellet, some people like that rush of energy that comes with injecting testosterone or with getting that just high from the hormones, which, like I said, you won't get with the ones that we use, but that is something that can happen. But alternatively, because of that spike, women can get hair loss, acne. They can also get bloating initially, which is water weight, but that increase quickly can make it seem like you're gaining weight, which is distressing for women.
Yeah.
So you have to just keep that in mind.
So why is it important that we have more testosterone and estrogen in our bodies at a certain age? I know our bodies obviously start to lose it because we don't need it anymore, or theoretically. So what is the benefit of having it, and who's a good candidate for it?
Okay. So let's start with the benefits of having it. So with the benefits of having hormones is they're protective for certain things. So if you look at a woman's risk of cardiovascular disease, so that heart attack, stroke, or just coronary artery disease in general, it goes up during the menopause phase because estrogen is anti-inflammatory and it's cardioprotective. So some of the studies show that if you do start in that early postmenopause window, so in the first 10 years, that it can be protective, starting hormone replacement, specifically estrogen. It can help with heart disease, decreases your risk of dementia. It can help with joint pain. A lot of women in menopause will get joint pain or something like frozen shoulder. If you've heard of frozen shoulder, that's one of the side effects. Women will get palpitations as well, and then they're going to a cardiologist and being put on a beta blocker, but sometimes it's just because their estrogen is going down. So you can prevent that as well. One of the other things is that they've seen a decreased risk in colon cancer with the use of estrogen and with testosterone. So testosterone just makes you feel good. I have a lot of women who come and they're like, I have brain fog, I'm having trouble focusing, my libido is low, I don't feel like myself. I hear that a lot.
Yeah.
And then you start them on testosterone, because sometimes that's like the first thing that I'll start them on, depending on their age. And they'll say, wow, I feel so much better, my head is much clearer, and their libido is up, which can be one of the main things that women are looking for testosterone for. So that is great. And then when you combine them, it helps protect your bones and helps maintain muscle mass. A lot of people don't realize that women are very high risk. 1 in 2 women will have an osteoporotic fracture in their lifetime. That's half of women. That's insane. And so we think, oh, it's just a broken bone. It's not just a broken bone, because 1 in 4 of those women will end up in a long-term care facility, and half of those women will not return to their pre-fracture, mobility. And that can be very distressing and significantly impact your quality of life.
Yeah, for sure.
So even just that, being on hormones, is FDA approved for the prevention of osteoporosis. And I don't think that the medications we have to treat osteoporosis are as effective as the prevention of it.
Okay, so that's something new that I had not heard. So I have osteopenia, so I'm getting close to full-blown osteoporosis. So another reason I should look more into this. But another side effect I've heard is that there's more hair growth with women that are on testosterone. Is that true?
Yes.
Okay.
And so that one, I think you can't escape that one.
You can't escape. Do you also get the lower voice and all the whole?
Okay. No.
Okay. We don't
Okay.
start turning into a man.
No, you do not start turning into a man.
Okay.
But I will say, so hair, you can have hair loss where you don't want it, which is in your hair, right? Everybody wants to lose that.
Right.
But you can have more hair growth on your face, right? So you might just have to wax more often, get your eyebrows done more often. If you go get a bikini wax, you're probably doing that more often. But it's nothing like you're not going to get hair on your chest or like start growing a beard. That's not, that's not going to happen. And I would say that, we talked about the different modalities. If you want to have better control of what's happening with your hormones, testosterone, we talked about injectables. You can do the injectables. I would not want to inject myself. So then the alternative to that is testosterone cream, which works pretty well. And that one you can control the dosing more. So there's less side effects with that.
Oh, good to know. All right. That's good to know. And it also helps with gaining muscle.
Yes, which is really important.
And I work out a lot, and I have a hard time gaining muscle, so that's
and that's something that I hear too. Like women will tell me, "Oh, I've always been active my whole life," and all of a sudden, like the amount of work I'm putting in the gym is not reflected in how I look. But as your testosterone goes down, it's just going to be harder to build and maintain muscle. So it's beneficial for that too.
Also for men, because I know my husband takes testosterone now, and that's what he says. He goes, now the work that I do in the gym is really showing. Like you can see the work, which is great. So anyway, let's back up a little bit. Let's start here. When women hit their 40s and things start to shift a little, what's actually happening in the body? So that's probably about the age where they're going to hit what's called perimenopause.
Yes.
So what's happening?
Okay, so during perimenopause, your hormones are going haywire. They're going up and they're going down. Some women will have like spikes in estrogen. And I think it's the spikes and the coming down that makes women feel crazy during this time. Like some women are really distressed with the mood symptoms, heavy periods, long periods. Like they'll have periods for like a week or two at a time or even longer. You're having just these hormonal shifts. And one of the things that I'm glad that you brought that up is that some doctors might say, well, you're still having a period, so you're not a candidate for hormone replacement. And that's not true. I wouldn't put a perimenopausal woman on estrogen, but you can put them on progesterone, which can help with their mood swings, can help with sleep, because sleep becomes an issue during this time as well. And if they're having low libido, or brain fog, you can put them on testosterone as well. So just because you're in perimenopause doesn't mean that you have to suffer through. Perimenopause can last 8 to 10 years. Mm-hmm. So you don't necessarily have to suffer through, but just keep in mind that your hormones are shifting. They're going up, they're going down, and that's what makes people feel bad.
So let me ask you this. If they're starting to feel that way, at that age, I remember I was seeing an OBGYN, right? Mm-hmm. That would have been the doctor I would have gone to for those kind of issues. Are they familiar with hormone replacement therapy? Would they recommend it, or do you really need to go see a specialist?
I would say that it depends on your OBGYN. So one of my best friends is an OBGYN, and right now we're both studying for the North American Menopause Society exam. You can go to that website, it's nams.org, and you can find providers on there who are certified to treat menopause, because she's very open-minded and we've had great conversations about hormone replacement. But I also have a lot of patients that come to me from their OBGYN and they're being told that they need to stop hormones right now or they're going to get cancer tomorrow. Mm-hmm. So I think that you do want to go to someone who is trained and has a background, because as I mentioned before, I didn't learn anything that I know about hormones through residency or in medical school. I think you have one chapter on women's health and it's like, this is menopause, period, move on. So you really have to do extra training to be here.
So we've brought this up a couple of times and I want to talk more about this. You've mentioned that doctors oftentimes will say hormone replacement therapy causes cancer, right? And that's a myth. So I know that it came from a study that was done probably 30 years ago, 40 years ago. You probably know better than me. But that was a very small sampling of people, right? And tell me what happened in that study, because I know that it exists, but it's escaping me as to exactly the science behind it.
So you're exactly right. That study is called the Women's Health Initiative. And that was the study. They took like one line from it and said it causes cancer, and now everyone's scared. But if you look at the study, one, they were dealing with an older population. one. Then the other thing is that they had two groups. You had a group of women who were on conjugated equine estrogen, which is a synthetic estrogen, and they had no uterus. And then you had a group of women who were on both the estrogen and the progestin, which is synthetic hormones. And if you look at the data on those two groups, the women that were on the estrogen only, they had a decreased risk of breast cancer. It was the group that was on the progestins and the estrogen that saw that increased risk. So the increased risk was not necessarily the estrogen, but the progestin, which is the synthetic progesterone. And if you have a room of 1,000 women, the 2 women in that group of 1,000 were at increased risk of cancer. I mean, which is still a low risk, and we don't want anybody to get cancer,
right.
But they made it seem like it doesn't matter who you are, everyone is going to get cancer, and that's not necessarily true, because now we're not using synthetics, very rarely, and we're using micronized progesterone, which is a bioidentical version of progesterone. So you can't really say that happens. And what was interesting in the group of women who had the estrogen, if you did get breast cancer, right, because we have to make this known, is that breast cancer is fairly common. 1 in 8 women will get breast cancer,
right.
Whether you're on hormones or not.
Right.
But the women who were on the estrogen had better survival rates.
And I think it's really important that we make that clear. So thank you for that, because I think that's really important that people understand where that came from.
Yeah.
Right. So for those with irregular periods, mood swings, or sudden fatigue, how can they tell whether it's stress, perimenopause, or something else entirely?
Well, I think it's important to do good testing, right? Just make sure that you check your thyroid. You want to check your micronutrient levels, because deficiencies in certain B vitamins can cause the fatigue. Thyroid issues can cause fatigue. I think that once you have all that information, right, just a thorough blood work, then you can kind of also look at, okay, well, maybe we start you on progesterone. You're not sleeping well, your periods are heavy, let's start you on progesterone, and kind of see how they respond to that. But I do think it's a little bit of a process of elimination. I wouldn't start anybody on hormones without having a full blood work panel to see if there's anything else. And sometimes it's both. Sometimes it's like, okay, maybe we start progesterone to help with sleep and mood while we're also dealing with these micronutrient deficiencies or something else that might be going on.
Sometimes is it just a supplement that they might need that you would recommend? I mean, I'm sure you don't always just go straight to bioidentical hormone placement.
That is, you'd be surprised at how many people I've had who I just start them on B vitamins and magnesium, and all of a sudden they feel better. Why the B vitamins? Well, B vitamins help with like energy and mood, and then magnesium helps with sleep and can help with people who are really stressed. It can help with that as well. And I've had patients who that's all that they need, because this is another topic that I've talked a lot about, is that our food is really, really depleted in nutrients. I did a presentation once, and when I was doing the research, there was a study that showed that if we wanted to get the same nutrition from an orange that our grandparents did, we have to eat 8 oranges to their 1.
Why?
Because
what's happening?
The soil is depleted.
Okay.
We're eating more processed food, right? So then people generally, because of that, will have depletion. But as far as like the soil quality is not the same. And then you have GMO. Is GMO the same? It's just the way we're growing our food is different. So I think people think that, oh, if I eat healthy, I don't need, any supplements, or I don't need to take a multivitamin. But that's not always the case.
That's interesting.
Yeah. So sometimes it's just a matter of just correcting those, and people feel better.
So take me through, we're going to get off script a little bit. Take me through, if I were to come visit your office for the first time as a new patient, walk me through what you'd want to see. You'd probably want me to have a blood panel done.
Well, not necessarily, because the blood panels that we order are more in depth than anything you're going to get from your primary care doctor. So it helps. When we do our first appointment, people will usually upload any labs that they have from their primary care doctor, any other doctor, any notes that they want me to see, anything that they want me to see, and I will review that before our appointment. But in general, it's very limited in comparison to what we test. So we'll go through all the stuff, your goals, your history, things you've tried that have worked or maybe didn't work. And then from that, we'll order our panels.
Okay.
But then if we need like a functional medicine test, what would that include? Maybe there's environmental factors. Maybe you've been exposed to mold, right? Or other pollutants that are in the environment. We can test for that. We can test for your gut, let's say gut health wise. Gut and hormones go hand in hand. So let's say that someone comes in and they're like, I have a lot of digestive issues. We want to be able to test their gut and see what's going on and see how we can correct that. So if we need any functional medicine testing, we'll do that too. After that's done, then you would come back and we come up with a plan based off of that. But sometimes we can say, hey, like try magnesium, you're very anxious or you're feeling low on energy. We can do things in the meantime, but we wouldn't start hormones or anything else until we see what the blood work is showing.
Okay. And so I mentioned Reveal Vitality is located downtown, and I know that you what's your
Dr. Davis.
Dr. Davis, thank you, have several other options there, like a hyperbaric chamber and a lot of cool stuff, right?
Yeah, it's a one-stop shop, I think, for things. So we have two, we're on 1990 Main Street. So we have the second floor where we have the Longevity Center. So the Longevity Center, you have a gym, but you also have some longevity treatments. You have sauna, you have hyperbaric oxygen, you have molecular hydrogen, which is helpful for energy as well. Then you have the cryotherapy, and then we have some like fun testing that you could do. So you have the VO2 max, which VO2 max has been shown to be a test that you can use for longevity, right?
Okay.
And sometimes we have people do the VO2 max before they start treatment and then after treatment and see how that improves. And then you also have equipment like Vasper or All-Core, which are machines like the All-Core's for your abs. And it's very short, but it just, you're rotating like on an axis and it's training your core for people who maybe can't do like 1,000 crunches. And then we have Vasper. In the Vasper machine, it's like 21 minutes a cardio machine, but the machine, the way that it is, and they like strap these things to your legs, it helps increase your growth hormone and your testosterone. So it's just like some fun things that they have in there that can help with longevity. And for someone who doesn't have a lot of time for working out, you can just jump on the Vasper for 21 minutes and you're done.
That's very cool. I'll have to go check that out.
And then on the 8th floor, I forgot to mention, we also have an IV lounge.
Okay.
So sometimes if we have patients who maybe are not absorbing nutrients or we know that they're low on B vitamins and they want to raise it quickly, you just jump into our IV lounge and we can do that there. And we're going to start offering stem cells soon.
Oh, okay.
At the end of the month.
All right. That's very cool. Got a lot of stuff going on.
Yeah.
A lot of stuff going on. All right. So we talked about what role, actually, we didn't really say. Tell me about how your approach to root cause medicine changes the way you treat hormonal imbalance.
Well, this will depend, right? I have patients who are perimenopausal who have not had, maybe irregular periods for several years, and through the testing and through the questionnaires, sometimes I can see if it's just lifestyle based. I had a patient once who had really bad digestive issues, which we corrected. She had really bad stress and she was working out in a way that was depleting her body. And just through lifestyle and decreasing her workouts, doing some yoga and meditation, we got her periods back to normal, and they had not been normal for 7 years.
Wow.
So just by like addressing the root cause in that case, which was the digestive issues and the high stress, she was able to get her hormones back on track. And sometimes that's all you need.
So is there a component then to your practice that looks at nutrition and then gives them a nutrition plan?
Yes, all the membership plans include a visit with a nutritionist, and some of them are higher, like you have more access to a nutritionist. But after we do the testing, we can say, okay, like this person needs to change their diet in this way, and they'll have the nutritionist appointment so that they can learn how to incorporate those changes.
And longevity is such a hot topic, right? Yeah. Especially here in Sarasota. They all want to live longer, look better, right? So we talked a lot about hormone replacement therapy and how much confusion there is. Is it a short-term fix, a lifelong plan, or something in between?
So no to short-term fix. I don't think hormones are a short-term fix.
Okay.
I think that we're going to start finding that you can be on hormones for a long, extended period of time. The old saying was, lowest dose for as short amount of time as possible. That's not really true, because the benefits we see as far as bone prevention, once you stop hormones, that goes away. Within 2 to 3 years, you'll be osteopenic or osteoporotic after that. So those benefits go away. And a lot of times when women stop these hormones, they start getting hot flashes and they start getting all the symptoms that they were trying to avoid. That comes back. there's no data showing that being on hormones long term is harmful. And so some of the women who are like pioneers in this, I love Kelly Casperson, Mary Claire Haver is another one. They say they're going to be on hormones until the day they die, right? Because there's really no harm that we've seen so far.
Yeah.
So I would say the longer, the better. And one more thing that I think people should know is that women who are on hormone replacement, they end up taking less pharmaceutical drugs in the long term because the hormones are addressing the root of some of those issues.
We've talked a lot about women being on hormone replacement. What about men?
I think it can be very beneficial for men. Men will see, as their hormone levels go down, they'll see similar issues such as increased cardiovascular disease, diabetes, weight gain in the belly area, which is very harmful. That's what causes heart attacks and inflammation. And also issues with cognition, erectile dysfunction, like that all happens to men too. And I think we're more aware of those changes that happen in men, and we don't really talk about how those changes happen in women too.
Right, exactly. So do you see men and women?
I see men and women.
You see both, yeah.
Yes, and one of the things that I joke, but I'm not really joking when I say it to my patients, is if I have a woman who comes to me and, we're fixing her hormones, I always ask, like, what about your husband? Because, one of the side effects of being on hormones is that your libido goes up. So you always want to make sure that the partners are on par and that both of them are getting their hormones.
You know what? Actually, I'm going to reveal something about myself. I'm really glad you said that because I told you earlier, my husband is on testosterone. I am not. And it is difficult when you're not at that same, you're not on the same playing field anymore, right? Because I am struggling a little bit. And he's like ready to go, So that is something we need to address because I want to be able to enjoy a full, healthy sex life with my partner.
Yeah, and doctors don't really ask that.
No.
And we have serious conversations in my office about, sex life because there's so many things that can impact your sex life.
Yeah.
And for some people, it's as easy as you put them on testosterone. But sometimes you have to dig a little bit deeper. And then when I always ask, what about your husband? Because how frustrating would it be if all of a sudden your libido is through the roof and you're ready to go and then your husband's like, no, I'm okay. So you do have to address that as a couple, I think.
I think that's great. And that it's probably a hard conversation for some people, but I think it's great because it's such an important part of a marriage.
Yeah. And I read, the book is called You're Not Broken. And I thought that book was so good. It's a urologist. And she talks about that. But the way that she asks questions and that she gets curious about it, I was like, wow. I was like, more doctors need to be curious about this because it really is one of the things that improves your quality of life.
Oh, for sure. 100%. I couldn't agree more. So I'm all ready to make an appointment. Let's go. Let's say you talk a lot about helping women reclaim their vitality. What does that look like in your own life and how do you stay in alignment?
Okay, so I like that question. So when I think about reclaiming vitality, I want to be as active as I can for as long as I can. I don't want to have mobility issues. I don't want to have cognitive issues. I want to be able to travel for as long as possible, go on walks with my dog and hiking. So I see it as, for me, it's being active because I did work in a hospital for a long time and I did see what happens when you don't take care of yourself. And it was very heartbreaking because a lot of times it's preventable, right? So for me, I am an avid gym goer. I love working out. I love going on walks with my dog. I do work a lot and I work hard. So it's trying to find a balance for me is hard, but I'm very mindful of okay, I need to take a break. And sometimes it's as easy as my husband and I saying let's do a staycation this weekend and let's go to Tampa or whatever. Maybe we're staying at the Westin just to unwind because I am very mindful of that. And then it's also with testing, right? Because we do have access to testing. We get our blood levels checked every 6 months. We'll do labs just to make sure that nutrient levels are on par, inflammation is down. So we are very proactive about our health.
That's great. That's great. When I used to think about my own vitality, my whole reason for wanting to stay young and youthful was the same, to stay active, but I was hoping to have grandkids that I could run after, but I don't. So there's still hope, but I don't know. Yeah, I don't see any of our 5 children having children anytime soon, sadly. What small daily habits have the biggest impact on women's hormonal and emotional health?
Hormonal health. Eating regular meals.
Okay.
Okay.
Breakfast, lunch, and dinner?
Yeah, I see a lot of women skipping breakfast.
Yes.
So I would say that. And then really, meditation or whatever that looks like to you. But I think having mindful moments in the day, whether it's meditation or sitting outside with a cup of coffee or, I mean, going on a walk with your husband at the end of the night, I think that makes a big impact because a lot of the women I see are just go, go, go. And what can I do for everybody else? And they don't take a moment for themselves to say, like, this is what I need right now.
Yeah, especially women that have young children at home, right? I mean, they're just so busy.
Yes.
Working, taking care of the kids, taking care of their husband. Yeah, well, that's a good one. I like that one. And I think it's so hard to just take a breath. But you're right. I used to do it when my kids were little. I would get up a half an hour before everybody else. That was just my time. I was like 30 minutes in the morning. I would sit quietly, make my coffee, and just kind of ground myself for the day.
Yes. Yeah, I think that's so important. And a lot of times women feel guilty about doing that, but I just don't think that you can feel good if you're feeling guilty about doing something for yourself.
Right, exactly. And you need to be healthy to take care of the ones you love,
Exactly.
right? I mean, you need to. So if a listener is sitting there feeling out of balance, where should she or he start tomorrow morning?
Okay, so tomorrow morning, I would say make a good, healthy breakfast with a lot of protein and go for a long walk. I would say that's really where you need to start. I know I've listened to biohackers say that the best thing that they do is get out in the morning and see the sunlight or ground on the earth. Like grounding really helps. There's studies that show that it helps. So I think that, what I do is great because we can prevent and help a lot of people. But I think that sometimes it's in the daily small things that we do that can make a big impact.
I couldn't agree more. So what's a good breakfast look like for you?
For me, so I love bread. I get sourdough bread, and I love an avocado toast with eggs in the morning.
Okay.
And if I have like arugula or microgreens, I'll throw that on there too.
So you're getting your protein from the eggs.
Yes.
Okay. All right. That's what I was wondering because you're advocating protein. Do you advocate protein 3 times a day, or how much protein should?
So I think, like, if I'm being realistic, the guidelines say it's like 1 gram per
pound, right?
Per pound.
Yeah.
And for me, that's just really unrealistic. I can't do that. So I would say that at least for me, I try to get around 70 grams of protein. And I mean, I guess that's like a little bit over half. I think you just do the best you can.
Yeah.
Right? That's what I would say. And as long as you're eating regularly and you're trying to get your protein, I think that you should be fine.
You should be doing all right. Yeah. Well, we're going to end with, it's time for a little fun. We call this the Rapid Joy Round. So 5 quick questions to end on a happy note. Are we ready?
Yes.
All right. What's your favorite feel-good song when you need an instant energy boost?
Okay. I love Odessa.
Okay.
So I'm going to say Moment Apart by Odessa.
Okay. I don't know that one. I'm going to have to look it up after. If joy had a flavor, what would yours taste like?
Salty. I love salty food.
Anything salty.
Yeah.
I love salty too, actually. I keep thinking, when I think flavor, I always think ice cream. That's where my mind went. I'm like, I'm a vanilla girl.
I thought like salt and vinegar chips is what came to mind.
Oh, okay.
Yeah.
Do you have a special brand? Do you have a favorite brand?
The Cape Cod.
Cape Cod? Okay. I used to be a Pringles girl, but now they've gotten so expensive.
Really? Yeah, no, I haven't had those in a while.
What's one weird or unexpected self-care ritual that always works for you?
Well, I don't know if it's weird. I like the PEMF mats. So I'll sit and work with the mat under my butt, and hopefully it's working. But that's just one ritual that I do at night when I'm working and still answering emails.
Now, what does that do for people who have never heard of that?
So the mats they help regulate your nervous system. They can help you sleep better if you use them. It's just emitting like small electromagnetic frequencies. And I really don't know if it helps, but just the fact that I'm sitting on it while I'm working makes me feel better.
You feel better? Okay, I like that. If you could host the ultimate hang, who's at your table and what are you serving?
Ooh, the ultimate hang. Okay, well, right now I'm really loving Kelly Casperson. What am I serving? Okay, I'm seeing like a Mediterranean themed dinner. So we would have like octopus and fish and salads. and then end it with tiramisu because I love tiramisu.
Yum. That sounds like a good dinner.
Yeah.
That sounds amazing. Finish this sentence. The secret ingredient to a joyful life is...
The people you share it with.
Oh, I love that. That is so true. I love that. Is there anything else that we have maybe forgotten to touch upon that you would like our listeners to know or learn tonight?
Well, one thing I always tell women is that if you've been invalidated or feel invalidated by a provider, it's time to find a new one, because I see that a lot, and it's not necessary. We know our body.
Yeah. I think I told you I have searched. That's why I gave up, because I think I spoke to 3 doctors locally, 1 in Atlanta, 1 in Miami. And I'm not kidding when I tell you, out of those 5, I got different information and advice from each and every one of them. And I threw up my hands and was like, why can't I get some consistent, information on this? This shouldn't be this complicated. It's very complicated.
It is. It is very hard. But I would say that there are answers out there, and it has to be individualized, and you need to feel heard. So as long as you know that whatever symptoms you're feeling, you're not alone and someone can help you, that's what we'll end that with.
Okay, and it's not too late for me.
No, it's not too late.
Okay, I love that. Okay, that was so good. Thank you for hanging with us today, Dr. Andarcia. If you love this conversation, please take a second to follow Joy of the Hang on Apple Podcasts or Spotify. Leave a quick review and share this episode with a friend who could use a little hormone hope and happiness. And if you want to see the hang, join us on YouTube. Subscribe to Joy of the Hang for full video episodes, behind the scenes clips, and maybe a few laughs we didn't plan. Until next time, keep laughing, keep connecting, and keep finding joy in the hang. Thank you so much for being here.
Thank you.